Hi, my name is Nina. Today I'm going to summarize growth and development for pediatric exam. We start with infant 1 to 12 months. Their birth weight double at the age of 6 months and triple by 1 year. They're 1.5 times the length of the birth length by the age of 1 year. Developmental stage. They like to put things in their mouths, trust and mistrust. They like to play with their hand and feet. So there is no toy for infants. So 1 to 4 months, they will coo and laugh. They follow objects since birth, and they also like to listen to the music box. 5 to 6 months. 6 months is really important. So they start to sit by 6 months and sit unsupported by 8 months. They start to crawl after 6 months, and they roll over. They know parents, mama and dada, and who's not mama and dada. They start to have initiate sound, and so no need toy for them at this time. So by the age of 9 months, like I said, they start to sit up. They can play peekaboo, permanent object permanent, and they can pick up things. They have stranger anxiety. They like to put things in their mouths. They start to standing and using their muscle tone, so they know that they start to calling dada first before mama. So by 10-12 months or the age of 1 year, they walk by 1 year. By the time 10 months, they sit unsupported and they looking for the object that you show them and you hide. They were looking for it. And also they start to initiate animal sound, meow meow, whoop whoop. So they like noisy toy. They start to talk. They're concerned about environments around them, and they just start exploring things. They will walk, stand and walk from place to place and touching things. So nutrition for the infants mainly is milk, and by the age of 6 months you can start to introduce new food to them. The first food they can have is like soft food, like rice cereal is the first one that you should give to them along with milk. And then when you introduce food for them, is you give them every week you give them, every other week you give them like new food. And when you introduce it, you give vegetable first and then fruit, because if you give them fruit first, they will never want to try vegetable. Major concern is that they're very, like you have to keep your cabinet locked everywhere, because they start to put everything in their mouth. So choking and foreign ingestion poison is very concerned. Okay, toddler, by the 18 months, or they start to walk by 1 year. 2 year they can run, and 3 year they use tricycle. 3 year 3 wheel. So they get faster and faster, and by the time of 2.5 year they start to potty training. So when you do potty training, make sure that they are ready to do. You're not forcing them to do. And at a toddler, they have teeth, 20 teeth. They're cognitive, they short sentence, they can start number. Developmental state is autonomy. So they like to do things by themselves. If you put food in front of them, they will like to try to eat by themselves. If you try to feed them, they will get cranky. So they can go upstairs. Like 2 years, they can like go boom, 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 like every using 2 feet. But then when the 3 years, they can go boom, 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 using 1 foot at a time. So the way that I remember it, I use 3 TR, which is 3. They can do stair, toilet, tricycle, and ours running. So they have on the side of the adult by the age of 2 years, 2.5, 20 teeth by 3 years. Okay, the front anterior fontanel closed by 18 months, and posterior fontanel closed by 8 weeks. So just remember that. And developmental state is autonomy, shame, and doubt. So they like to ask question why. Their nutrition, they like to feed themselves. Calcium, snack, and safety is like a big concern. And they like to play with toy, like push and pull toy, because they start to walk anything that they use muscle or they can walk around, running around is good. So you make sure that you lock every cabinet, lock every door, everything have to concern about safety. So at this age they have fear because like let's say the fear of separation or anxiety when you drop them at school, and they will cry, and then you know, when you go to pick them up, they not really want to come to see you because they're going to all the stages. What is that called? Despair, denial, and protest. So the infants, they not really have an idea of death and dying. Toddler and preschool, they view death and dying as temporary, and the school age, they know, they have an idea of death and dying, and they view as it's gonna hurt. And adolescents, they view as this, you know, they're angry. Preschool is you know, like 4 to 6 years. They're slow grow. The way I remember it is like 440 T. T come from they know time, they can tie their shoes, and they're very talkative. Preschool, they will start to have the permanent teeth, and their developmental stage is initiative and guilt. So they like to help you to do things, you know, like, mommy, can I help you cook, can I help you clean? And they're always curious about things. They like to play costume, you know, pretend play. They talk a lot, they explore the world, they're very talkative. Toy that they like to play, just dramatic play. Just like when we're little, we play with a doll, pretend to be father, mother, just pretend, yeah, because they have like imagination. They have fear of death, disease, punishment, and they like to do things that take accomplishment, like because their developmental state is industry. So anything they have to do industry, they like to do things. They're concerned about obesity. They view the dead is gonna be hurt. Girl like to play with girl, boy like to play with boy. That's normal. They have full permanent teeth. They know right or wrong. They kind of have an idea of this. And the boy, they like to play like team rule. Sometimes they make up their own rule. They like to play sports. Whatever that they like to do. Pretty much that's it. So, you know, like basically the even years seem to be harder than the odd year. So, you know your kid, like 2, they are terrible, very traumatic. 3 years, they're very sweet and trusting. And then by the time 4 years, it's like, oh, frustrating. They're jumping around. And by the time the 5, they are like fascinating. They have a lot of imagination. They're talkative. They have, by the time of 5 years, they know they can do so many things, and they also like thing, like they can lie about many things. So don't believe it so much. By the 6, it's like very hot stuff, and 7, they're sweet, and by 8, they're like, wrestling with their friends and sibling. By 8, 9, they are sweet again. So, and that's it for the first half of growth and development. I will do the video for the second part of the adolescents. Okay, and see you next video.